This video is about stuttering therapy for school-age children. If you like these videos, please buy my book, Making Stuttering Therapy Work, which is available on Amazon. So the first question is, can children do fluency shaping therapy? And the answer is yes. A 2020 study had 119 children and their parents do a 6-day intensive fluency shaping program, followed by 6 months of maintenance therapy. Treatment included group therapy and regular therapy at home. More than 80% of the children had large improvements in fluency a year after treatment. 17% of the children experienced no benefits, which is better results than with adults who fluency shaping programs usually about 2/3 to 70% of adults benefit, and maybe 25 to 30% of adults don't benefit. Now I'm going to talk about the question, who is the best therapy provider for school-age children? Speech-language pathologists in a speech clinic, or parents at home, or a computer? So a study of 98 children aged 9 to 14 years old compared 3 types of stuttering therapy. So the first group did intensive smooth speech fluency shaping therapy, which trained relaxed diaphragmatic breathing, a slow speaking rate with prolonged vowels, gentle onsets and offsets, also called the loudness contour, soft articulation contacts, and pauses between phrases. The children did this therapy in a speech clinic for 35 hours over the course of a week. The second group did home-based smooth speech fluency shaping. So this was similar to the first group, but the parents were included, and the parents were encouraged to continue therapy at home. The therapy was done in the speech clinic for 6 hours once a week for 4 weeks, which is 24 weeks total. The third group did electromyographic biofeedback in the speech clinic for 6 days a week for 5 days, 30 hours total, and they had minimal interaction with the clinicians. Then there was a fourth group, that a control group, that did not receive any treatment. All 3 treatments were effective immediately after treatment. All 3 therapies reduced stuttering below 1%. And the control group had no improvement in fluency. 1 year later, the percentage of children with disfluency rates under 2%. You want to guess who was the most effective? Who was the least effective? Well, it turns out 40% of the children who received 48% of the children who received speech therapy in the speech clinic with the speech-language pathologists were under 2% disfluency. 63% of the children who received therapy from their parents, and 71% of the children who used the EMG biofeedback. And the results for disfluency rates under 1% were even more striking. 10% of the children from the clinician-based program, 37% from the parent-based program, and 44% from the computer-based program. So, in other words, the computers were the most effective. The parents were close second, and the speech-language pathologists were we're a distant third. We're the least effective in the long run. So this is, in my opinion, an important study. So it's saying that the parents are better therapy providers than speech language pathologists if the parents are trained by a speech language pathologist. So what's happening here is that the parents are with their children every day. They can do therapy every day, as compared to seeing your speech language pathologist once or twice a week for 20 minutes, is typical in school, or 1 hour in private practice is not as effective as the parents doing therapy at home every day. So that's the end of this video about stuttering therapy for school-age children. Look below the video for a link to buy my book, Making Stuttering Therapy Work, on Amazon. You can look for a button to click to watch the next video. And if you're watching this video on YouTube, please click the like and subscribe buttons below the video so that I get a share of the revenue from the ads you've seen. And finally, my website is casafuturatech.com.